Welcome to the deep dive. Think about the pain relievers just sitting in your medicine cabinet.
Yeah.
Chances are acetaminophen is probably one of them. It's
hmm
just so common, right? So available.
Absolutely. You hardly think twice about it.
Exactly. But, for our pets, our animal companions, this seemingly harmless over-the-counter drug can actually be a silent danger.
That's so true. What our bodies can process pretty easily can have completely different, even deadly effects on pets, especially cats and dogs.
Right. It's a really critical difference for pet owners to get their heads around.
Definitely.
So if you've ever maybe been tempted to ease your pet's discomfort with something from your own medicine stash, or maybe you're just keen on keeping your furry family safe.
Which hopefully everyone is.
Yes, then this deep dive into acetaminophen toxicosis is really for you. We've looked into the medical literature quite a bit to figure out why this everyday medication poses such a serious threat.
So what's the plan?
Well, our mission today really is to sort of unpack the reasons behind this toxicity, figure out which animals are most at risk, and really highlight the key signs that should, immediately set off alarm bells.
Okay, let's dive in. What actually happens inside a pet's body when they say swallow an acetaminophen pill? What is acetaminophen toxicosis, just in simple terms?
Well, basically, it's poisoning. It happens when a dog or cat gets acetaminophen, whether, they accidentally find a dropped pill or, sadly, sometimes an owner gives it to them thinking they're helping.
Right. And the core issue
The
is,
fundamental problem is really about their liver's ability or inability to break the drug down safely. You can imagine the liver has like special tools or pathways to process stuff.
detox pathways.
Exactly, detox pathways. Two main ones for acetaminophen are called glucuronidation and sulfation.
Okay. And what happens when the liver tries to use those tools on acetaminophen in a dog or a cat?
Well, in small amounts, they might cope, but when the dose gets too high, these main processing tools, they just get overloaded.
Like a traffic jam on those pathways.
The perfect analogy. Too much traffic on a small road. And when that happens, the body's forced to use a different kind of less efficient pathway. It involves something called cytochrome P450.
Uh-huh. And that detour causes problems.
Big problems. This alternative route creates a really harmful byproduct. The short name is NAPQI.
NAPQI. Got it.
Yeah, think of NAPQI as like a tiny sticky bomb going off inside the liver cells.
Oof, okay.
It latches onto really important protective molecules in the liver cell, specifically things called glutathione and sulfhydryl groups.
And that binding causes damage.
Yes, exactly. It damages and eventually kills liver cells. That leads to a really serious condition, kind of hepatic necrosis.
So the liver takes the main hit from this damage, especially in dogs, is that right?
That's generally what the research shows, yeah. For
Uh-huh.
dogs, we usually start seeing signs of liver trouble when they ingest more than about 100 milligrams of acetaminophen for every kilogram they weigh.
Okay, 100 kilograms for liver issues.
Right. And if the dose goes higher, say over 200 milliglobulinograms, they can also develop something called methemoglobinemia.
Methemoglobinemia. That rings a bell. That's the one where the red blood cells can't carry oxygen properly, isn't it?
You got it. It's like their red blood cells just lose their main function, their ability to transport oxygen.
Which is obviously critical.
Absolutely critical. But while that's a serious concern in dogs, especially at those higher doses, while cats face an even more immediate and frankly graver threat.
Yes, I was reading that their reaction is quite different
hmm
and much, much more severe. What is it that makes cats so incredibly susceptible?
It really boils down to their liver's very, very limited capacity to get rid of acetaminophen safely. Unlike dogs, cats are just not very efficient at using that first main detox tool we mentioned, glucuronidation.
Ah, that first pathway.
Yeah, and what's kind of fascinating but also terrifying is that in cats, both of those main liver processing tools, glucuronidation and sulfation, get overwhelmed incredibly easily, even by really small amounts of acetaminophen.
So we're talking like even a tiny piece of a pill could swamp their system.
Precisely. It doesn't take much at all. And because their detox systems get saturated so fast, their red blood cells become extremely vulnerable to damage.
Okay, how does that happen?
Well, when that toxic NAPQI builds up, because the liver can't handle it, it depletes their natural protective shield, that glutathione we mentioned.
Right.
Without enough glutathione, the red blood cells suffer significant harm, oxidative injury, and remember, methemoglobinemia.
Yeah, oxygen carrying problem.
Yeah, cats can develop the methemoglobinemia, at frighteningly low doses. We're talking just 50 to 60 milligrams per kilogram.
50 to 60. Yeah, that's
Huh. Often that can be just half of one standard strength acetaminophen tablet.
That is absolutely shocking. Just half a tablet, potentially. And the sources also mentioned another specific danger for cats, didn't they? Something about their blood chemistry.
Yes, good point. In cats, it's not just the NAPQI pathway causing trouble. Acetaminophen also gets broken down into another compound called p-aminophenol, PIP for short.
PP. Okay, another bad actor.
Really nasty one for cats, yeah. This PPAP directly attacks the red blood cells. It causes rapid and really severe oxidative damage.
How does it do that?
It binds straight onto the hemoglobin, the part of the red blood cell that actually carries the oxygen.
Right.
And that binding very, very quickly leads to methemoglobinemia.
So it's like a double whammy for cats.
Yeah.
They get the liver damage pathway and this direct, fast assault on their red blood cells.
Exactly. It's a two-pronged attack. And the information suggests that in cats, this super fast developing methemoglobinemia can actually be fatal.
Before the liver damage even fully shows up.
Potentially, yes. Their oxygen supply can just plummet so quickly that the liver damage, while still happening, might not even be the immediate cause of death.
Wow. That's incredibly serious. So, okay, we've talked liver, we've talked lead. Are there other body systems that get hit by acetaminophen toxicity?
Yeah, definitely. If we zoom out a bit, the sort of hemiclump immune system, basically blood and immunity, is heavily involved. That's mainly because of the glutathione depletion, the red blood cell damage, and the resulting methemoglobinemia.
Okay.
The liver, the hepatobiliary system, as we've discussed, that's a major target, particularly in dogs where necrosis is more common.
Right.
But then there's the cardiovascular system. Interestingly, mostly just in cats, we sometimes see edema.
Edema, swelling.
Yeah, swelling, typically in the face, the paws, sometimes even the front legs.
Do we know why that happens?
The exact mechanism isn't totally clear, according to the sources. It seems specific to cats, though.
Fascinating.
Yeah.
And just to circle back, we mentioned it earlier, but the root cause of this huge difference between cats and dogs, it's really down to their basic biology, their genetics, right? Especially that glucuronide pathway.
Absolutely spot on. That genetic limitation, that deficiency in the cat's ability to effectively use the glucuronide conjugation pathway, that's the absolute core reason they're so exceptionally vulnerable.
They're just missing a crucial tool for handling this specific drug.
Precisely. A tool that dogs have, and we have, but they just don't, or not effectively.
Okay, so given this really dramatic difference in how common pets react, how often does this actually happen? How common is acetaminophen poisoning?
Well, sadly, it's reported as a relatively common drug toxicity in cats.
Really? Common?
Yeah, which is likely just because acetaminophen is everywhere, right? It's in so many households. It's less frequently seen in dogs, maybe because owners are perhaps a bit more cautious about giving dogs human meds without asking a vet first. Or maybe dogs are just less likely to get into it.
That makes sense. Okay, so this is clearly a real risk. What are the absolute critical warning signs that a pet owner needs to be watching for if they even suspect their animal got into some acetaminophen?
Okay, key signs. Early on, it might look like just general lack of energy, sort of depression, or maybe faster breathing than usual, hyperventilation. Look at their gums and tongue if they start looking dark, dusky, or even brownish. That's a red flag. These signs can show up pretty quick, usually within maybe 1 to 4 hours after they ate the pill.
1 to 4 hours.
Yep.
Okay. And if they get to the vet, what might the vet observe?
Well, the vet might see that depression getting worse. They might notice drooling, maybe vomiting, signs of abdominal pain if they press on the belly.
Okay.
That rapid breathing will likely still be there, or maybe it's worse. And then the color of the gums and tongue, if it's bluish, that's cyanosis or kind of muddy brown.
That's the methemoglobinemia, right? The poor oxygen.
Exactly. That's a really strong indicator of methemoglobinemia. Lack of oxygen getting around.
Any other physical signs?
Yeah, as time goes on, maybe after several hours, you might see that swelling, the edema we mentioned, face, paws, forelimbs.
Okay.
And a really alarming sign, particularly in cats, is if their urine turns dark brown or almost black, sometimes described as chocolate-colored.
Chocolate-colored urine. What does that mean?
It means there's breakdown products from damaged red blood cells and methemoglobin itself being filtered out by the kidneys and into the urine. It's a very bad sign.
Wow, okay.
You could also see yellowing of the skin or eyes, that's jaundice, indicating liver issues, maybe a low body temperature, hypothermia, signs of shock. And, tragically, without fast treatment, it can lead to death.
It sounds like a really frightening and rapid decline. Now, obviously the cause is eating acetaminophen, but Are there things that make some animals even more likely to get severely sick? Risk factors.
Yeah, the literature does mention a couple of things. Pets that have poor nutrition, specifically if they're low in glucose or sulfate,
Hmm.
they might be at higher risk. Their body's natural defense systems might already be struggling. Also, and this is important, if a pet is already on other medications that also tend to deplete that protective glutathione in the liver.
So interactions are possible.
Definitely. Taking those other drugs at the same time can make the acetaminophen toxicity much worse because the body's defenses are already lowered.
That really drives home why you need to tell your vet absolutely everything your pet takes, doesn't it?
Absolutely. Every supplement, every medication. Okay, so let's say a vet suspects acetaminophen poisoning based on these signs and the history. How do they actually nail down the diagnosis?
Well, first they'll think about other things that could cause similar symptoms. That's the differential diagnosis.
Right, rule out other nasties.
Exactly. So for a liver injury, they might think about toxic mushrooms, maybe blue-green algae exposure, aflatoxins from moldy food, certain metals, the sweetener xylitol,
Oh yeah, Xylitol is bad too.
very bad. Also, cycad palms, even other pain relievers like NSAIDs can cause liver issues.
Okay. And for the methemoglobinemia, the blood issue.
Other possibilities there could include things like onions or garlic, especially in large amounts, naphthalene, which is in mothballs, certain chemicals like chlorates or nitrites, sulfites, phenol, even some topical anesthetics like benzocaine or propylene glycol, especially in cats.
Wow, quite a list. So ruling those out is step one. What about specific lab tests?
Blood tests and a urine analysis are absolutely key. Finding methemoglobin in the blood is a big clue.
Okay.
And then watching the liver enzymes, things like ALT and AST. If those are high and keep climbing over time, that's really characteristic of the acetaminophen damage.
So rising liver enzymes are bad news.
Very bad news. As the liver function gets worse, the vet might also see other changes in the blood work, like lower levels of BUN, cholesterol, and albumin. But bilirubin might go up that causes the jaundice.
Right.
And in cats, specifically in cats, within about 72 hours, you often see something called Heinz bodies in their red blood cells under the microscope. Heinz bodies, abnormal clumps.
Yeah, they're clumps of damaged hemoglobin. The blood work might also show anemia, not enough red blood cells, or signs that red blood cells are breaking down, like free hemoglobin in the blood plasma or blood in the urine.
And can they actually test for the acetaminophen itself?
Yes, there are specific lab tests that can measure the actual level of acetaminophen in the pet's blood, either plasma or serum or in their urine.
Useful for confirmation.
Definitely. Things like x-rays or ultrasound, though, they aren't generally helpful for diagnosing the specific poisoning.
Okay.
But, if an animal unfortunately doesn't make it, a post-mortem exam and autopsy can show characteristic findings like the methemoglobinemia, fluid in the lungs, that specific pattern of liver damage, central lobular necrosis, and sometimes kidney damage, too.
Right. Okay, so once it's diagnosed or even highly suspected, what's the game plan? What are the treatments?
Okay, treatment. First off, immediate vet care is absolutely crucial. Time is critical.
Right.
If methemoglobinemia is suspected, or if the pet has that dark urine or looks jaundiced, they almost certainly need to be admitted to the hospital for intensive care.
Okay, hospitalization.
Yeah. And the veterinary team will handle them really gently, try to minimize stress. Now, if the pet just ate the pills, say within the first 4 to 6 hours,
Uh-huh.
they might try to induce vomiting, make the pet sick, or perform what's called gastric lavage, basically pumping the stomach to get any remaining drug out.
Decontamination, basically.
Yeah, exactly. Decontamination. If the pet is really anemic from the red blood cell damage, they might need a blood transfusion.
Okay.
And then there's supportive care, which is vital. Things like intravenous fluids to keep them hydrated and support circulation, and oxygen therapy if they're struggling to breathe or have that methemoglobinemia.
Makes sense. Fluids and oxygen.
Yeah. They'll usually hold off on food for maybe 24 hours after treatment starts, then offer small amounts of something bland. And keeping them quiet, restricting activity is also really important.
Got it. What about specific medications to actually counteract the poison?
Right, the antidotes and other meds. Activated charcoal is usually given pretty early on after the vomiting or lavage.
To soak up any leftover toxin in the gut.
Exactly, it binds it up. Then, the really crucial antidote is a drug called N-acetylcysteine. You might hear it called NAC, or the brand name Mucomyst.
N-acetylcysteine, okay? How does that work?
It basically helps the body replenish its stores of that protective glutathione we keep mentioning.
Boosting the body's own defenses.
Precisely. More glutathione helps neutralize that toxic NAPQI metabolite before it can do more damage. It's usually given as an initial higher dose, a loading dose, and then followed by several smaller doses over time. It can be given by mouth or often intravenously.
Okay, NAC is key. Any others?
There's another one, S-adenosylmethionine, usually called SAME. It also helps support liver health and can act as a glutathione precursor. It has specific dosing, too.
Same, okay.
Now, you might sometimes hear about using other things like methylene blue or cimetidine or even ascorbic acid, which is vitamin C. But the sources suggest that the benefit of those is kind of debated among vets. Not everyone agrees they're helpful, or they might only be used in specific situations.
Right. More controversial.
Yeah. And critically, the vet needs to avoid giving any other drugs that could make methemoglobinemia worse or cause more liver stress.
Makes sense. Don't add fuel to the fire.
Exactly. And they also need to be careful with drugs that rely heavily on the liver to be broken down, because with a damaged liver, those drugs might stick around longer and have stronger effects.
Or drugs that need the liver to activate them might not work as well.
Also true. Good point. So it's a really comprehensive approach. Remove the toxin, counteract its effects directly with things like NAC, and support all the body's vital functions while it tries to heal.
Okay. So after all that intensive treatment, what does the follow-up care look like?
Close monitoring is absolutely essential. Methemoglobin levels in the blood need to be checked frequently, maybe every couple of hours at first, to see if the treatment is working.
Okay.
And liver enzyme activity, those ALT and AST levels, they need to be checked regularly too, perhaps every 12 hours to track the liver damage and hopefully see it start to improve.
Watching for recovery signs.
Right. But honestly, the most crucial part of follow-up is prevention. Making sure this never, ever happens again.
Which means
absolutely never give acetaminophen to cats. Full stop.
Wow.
And for dogs, only give it if your veterinarian has specifically prescribed it at the exact dose they recommend, and be incredibly careful.
Got it. Avoidance is key. Now, even if a pet seems to recover, are there any potential long-term health issues people should know about? Complications down the road?
Yes, unfortunately, there can be. Depending on how severe that initial liver necrosis, the liver cell death, was, there's a risk of scar tissue forming in the liver as it heals. That's called fibrosis.
Liver scarring.
Yeah, and significant fibrosis could potentially lead to long-term problems with liver function, even if the pet seems okay initially.
Something to keep an eye on long-term then. Okay, so let's talk prognosis. What's the overall outlook for pets poisoned with acetaminophen? How likely are they to pull through?
It really varies. The rapid development of severe methemoglobinemia is always a very, very serious sign.
Right.
If those methemoglobin levels hit 50% or higher, the prognosis is generally considered grave, very guarded.
50%. That's a critical number.
It seems to be, yeah. Also, if those liver enzyme levels are still rising steeply 12 to 24 hours after the pet ingested the drug, that's another major cause for concern about the outcome.
Okay. How long do the signs usually last?
The clinical signs of illness, the depression, breathing issues, discoloration, all that, it can persist for anywhere from 12 to 48 hours, roughly.
And the risk of death?
Sadly, death from the lack of oxygen due to methemoglobinemia can happen at pretty much any point during that acute phase.
Scary.
It is. However, and this is important, there is definitely hope.
Good.
Dogs and cats that get prompt, aggressive veterinary treatment that successfully brings down the methemoglobin levels and prevents really catastrophic liver damage, those pets actually have a good chance of making a full recovery.
So acting fast makes a huge difference.
A massive difference. The medical info does give some sobering average timelines, though. For dogs, if death occurs, it's often within about 72 hours, usually due to that severe liver necrosis.
Okay, 3 days for dogs.
Yeah. Roughly. For cats, because of that rapid methemoglobinemia, death can happen even sooner, often within 18 to 36 hours after they eat the acetaminophen.
Wow. Less than 2 days for cats sometimes.
Yeah. It really just hammers home how incredibly critical it is to get immediate veterinary help. Don't wait and see if you suspect this. So I think the biggest takeaway from our deep dive today has to be this. Acetaminophen, that super common, seemingly harmless pain pill for us humans.
Yeah.
It is extremely dangerous for our pets, and especially critically lethal for cats.
Because of their different metabolism.
Exactly. Their unique physiology just means they process this drug totally differently, and even a tiny amount can have devastating, potentially fatal results.
So the rule is?
The golden rule is simple. It's absolute. Never, ever give human medications to your animal companions unless your veterinarian specifically tells you to, period.
Please, everyone, listen to that.
Yeah. Please be extra careful about storing all medications safely away, out of reach of curious noses and paws. And if you have even the slightest suspicion your pet might have ingested acetaminophen, don't waste a second. Get immediate veterinary attention.
That's the best advice. And, this whole discussion really brings up an important point for you, the listener, to think about. Considering just how many different over-the-counter pills and potions we keep in our homes, what other seemingly innocuous, everyday substances might actually pose unexpected and really serious risks to our beloved animal companions? It's definitely something worth mulling over, just to keep them as safe as possible.